So, parents, don't mind me, just on my lunch break. But while I was sitting here eating, I noticed RFK and his statements about black children all being on some sort of medication for their ADHD, like Adderall and everything, and using that as a justification to have them removed from the homes. I, for those of you that do not know, am a psychiatric mental health nurse. And I have been in the field for, 6 years at this point, specifically an inpatient, and I specialize in adolescent psychiatry. I have a lot of things. So within this realm, and I've also worked in pediatrics for most of my, at least half of my career, about 19 years total in my career. So point is, I know what I'm talking about. And I'm the best, one of the best, if not the best psych nurse that you know. Specifically, adolescent psych nurse that you know. Ask about me. Anyway, a lot of my work, a lot of the push that I give is to not utilize medications, because I often tell people that they are not my first go-to, because a lot of this de-escalation, a lot of this work and interpersonal skills and coping strategies that I want to teach are free. It's free to do. It doesn't cost you anything. You don't need a doctor's script to do it. You don't need to refill a prescription or go to a pharmacy. No, you can just do these things at home. So within that, what I am saying is that there are ways of dealing with and engaging with your children that'll help you to curb some of these behaviors, and a lot of it involves listening to them and making changes within yourself, because you don't know everything and you're not right about everything. With that being said, getting children and getting people to the point where, yes, medication is helpful. It can really help stabilize a lot of things and balance out some the wiring in your brain. And some things do just simply require medications to treat. A lot of things do not. A lot of things do not, but it requires work. And that is the issue that a lot of people have. They do not want to do the work, they want a pill. We see this with adult medicine all the time. We see this with hypertensive patients, diabetic patients, type 2 diabetes specifically. We see this patients with renal failure and issues. A lot of this inflammation, a lot of these things can be adjusted in non-pharmaceutical ways. However, people, maybe that's you, maybe it's not you, but people prefer to use drugs to counteract the symptoms that they're experiencing. And now with the Medicaid, Medicare reimbursements being cut, funding getting pulled, there's no money in it for you. A lot of the people are dependent upon the system and these government benefits. Those benefits are not guaranteed. That money is not guaranteed. These things are not going to always be here. And with the way that this administration is spending money, can you rely on this? So what I recommend, if you want, you can follow me. You can DM me. You can reach out to me. I offer my support, services, advice to people, to anybody that is willing to take them. It is going to require work. There will be some things that you have to address within yourself in order to listen and deal with your kid. However, this is the future that we're looking at. And the idea that if your child has ADHD and don't get it twisted, a diagnosis can be adjusted easily. Diagnoses, they get tossed around haphazardly at times. And they will label someone with something instead of looking further, especially someone who is not conscious of Black American culture and our cultural norms. And they will read a lot of these behaviors as aggressive, as oppositional, as defiant. They refuse to give us PTSD related to slavery or post-traumatic slave syndrome. I believe that's what Christina labeled it. I love that title too. I'm not sure if she originated it, but I did get that from her. But yes, the idea of post-traumatic slave syndrome, the neurodivergency that shows up in our communities often. Autism is not even really respected in the spectrum in the Black community, as with most things. Find out the maternal mortality rate? Yeah. Oh, also look at the violence that we are met with when having a psychotic break. And don't let it be substance-induced psychosis. They'll murder you in the street. They do it at a traffic light, a traffic stop, when no issues are present. So, if you want to keep your kids, I suggest you start doing the work and stop putting it off on other people. You're the parent. Or better yet, I encourage people who don't care to do this work, because there's no guarantee that your kid won't have something. At the least, they will have some genetic variation due to, especially if they're Black American, due to our history, they will have a genetic related issue, a genetic dependent condition that will show itself in a lot of various ways. So, let's do the work. I offer my services to anyone. If cost is your issue, reach out. You won't know. I always tell my kids, you never know until you ask. I've not said no. But y'all be safe out there.